Dopamine, which is important in Parkinson's disease, happens to run the sleep. Most of the stuff that does timing and staging of sleep, not the complicated dreaming, all the things that happen in the endocrinology, just the clock that tells you what time it is and sends a message, okay, it's 10 o'clock, time to get that melatonin out there. The clock and the paralysis have to be intertwined tightly. You do not want to get paralyzed at any time except when you're sleeping. But these two things intertwine right next to that headache stripe. And why would my patients, who are young, healthy women, have two different sleep disorders? So Perkins went through all these different things that we see. Unexplained awakening to light sleep. Leg kicking, we don't know why. Why is it periodic? Why do they stop breathing a little bit? Why is it that my patients that stop breathing a little bit have a little bit of leg kicking? I completely agree with Dr. Perkins that it's not the oxygen. It's the sleep interruption that makes the patient sick. How could I model this switch so they only have one problem? In biology, instead of a consistent thing, so we have to stay paralyzed. What we do in biology is not a stream of electrons buzzing through the wall. What we do in biology is we have neurons that send pulses of neurotransmitters. We perceive it as a constant state, but it's always at a certain rate. So it turns out that I began to think of this. What if we model it, and I make up these things because I want to teach my patient this, so they won't think I'm a total nut, okay? So I'm saying, what if we talk about the paralysis, which is a speedometer needle, and it has to be cruise control 65 miles an hour, and it starts to wobble a little bit. What will you see? It'll wobble a little bit towards too paralyzed. Uh-oh, where do you lose? Well, the legs are already paralyzed. You won't lose there. You lose here. Too paralyzed. What's going to happen? Uh-oh. You breathe in. This collapses. It turns out that the brain already has a little switch that's watching for that air movement. He showed you that on the thing. It's not that the technician comes in and wakes that person up to light sleep. No, your brain is already designed. As soon as the air passage stops, it wakes you right up to light sleep. It's already designed with that engineering difficulty in mind. You swing to too paralyzed for one brief moment. You wake up to light sleep immediately. What if you swing towards not paralyzed enough? Talking, chewing, jaw pain, leg movements. I learned, as Dr. Perkins has learned, that we have these goofy leg movement medicines. We don't know what they're doing, but the patient comes back and says, you know, my CPAP device, I'm wearing it every night, my headache's better, my mood's better, my memory's better, but my knees still hurt. I look back, oh, you're moving your legs a lot. I'm going to give you this blah, blah, blah medicine, make your legs stop moving. The knee pain goes away. They wake up in the morning with no knee pain. That's pretty amazing. That's when I started to make up this idea that, oh, you have to be paralyzed. All the moving parts of your body have to be perfectly paralyzed in these phases of sleep to get the repair. And it turns out that most of the pain that we wake up with is from the waist down. Back, hips, knees, different for each person. You got an old football injury, it'll be that knee that'll hurt you first. Okay, let's just say then that we have this paralysis switch. It's swinging back and forth. We see both of those things. Then all of a sudden, everything kind of falls into place for me. I'm looking at one after another of these sleep studies. What if we try to get it in sort of an overall idea of what's really happening here? Every single one of these people have a problem with either the timing of sleep or the paralysis of sleep. They either can't go into a phase, can't stay in a phase, or their paralysis is not correct. Apnea or leg movements. So, as I send more and more and more people, I start to have more and more diseases that get better. All of a sudden my Parkinson patient comes back and they're not trembling anymore, and I haven't added a medicine. That is very impressive to me. That means I could actually cure people by getting their sleep better. And again, I'm thinking, why is everybody in my practice got a sleep disorder? And my patients say things like, I know you guys made it up. We want, you know, you're making money on these CPAP devices. I know it's just to make money. Well, it turns out if I were going to make money on the CPAP devices, I would have actually gone into a different career. And from my point of view, they were a pain. I hear, you know, an hour and a half every night after I finish seeing my patients talking about their stupid CPAP device. I completely understand what Dr. Perkins is talking about. It's terrible. Now, that guy who said, are you sure it's going to help me? I guarantee you, if you said to him, all you have to do is go to Walmart and buy this pill and take this, he's going to be really happy about that. Plus, all these other things get better too. There are several things that make, when we stumble into this vitamin D thing, make it make sense. One, it's a societal change. Children, young adults, older people in developed countries, the percentage of sleep disorders, if you just take not just CPAP needing adults, but everybody who doesn't sleep well and doesn't feel rested and has to take pills for something because of all the things that Dr. Perkins described to you, that's a lot of people. It's much more common in developed countries. I have a house in Mexico. I actually go to places where there is no electricity. They still live in sticks. Only one guy in the whole town is fat. Who? The policeman. He's got a little block house and he's got a window unit. It's the only electricity that comes to the whole town. He's the fat guy. He's got hypertension. Everybody else lives outdoors. Sleep apnea is not epidemic in Thailand, where they're still plowing behind some pack animal. And I'd already seen that and wondered about it and was thinking more along the lines of what toxin comes from internal combustion engines that could be doing this to us, because it's everybody. So then here's what happens to me. Here's all the stuff that's associated with sleep apnea. He did a great job in leading up to this. He did a great job with this. Obesity comes from the same thing that causes sleep apnea. It's not that you get sleep apnea because you're fat. He did all the stuff I don't need to do it. Ghrelin, leptin, orexin, all are related to the same thing that causes the sleep apnea. And those of us who don't have sleep apnea still get big fat butts. Who gets a big fat butt? The women after they have babies. And I'm going to explain to you why that is. Okay, CPAP is a disaster, okay? I hated it. I did it. I was a big convert. I would do the same thing that Dr. Perkins described. I would sit at my poor husband would sit at the social and things and tell these people about why they needed CPAP. I mean, he would just get so embarrassed. But it works. Now, here's the next thing that happens. I'm thinking now, not only is there something interesting going on in the background, but how come everybody in my practice has a sleep disorder? It's not just the headache patients. It's this elderly person. It's this youngster. Why is it everybody? And all of a sudden I have this shift in the way I look at things. In medicine we're taught 5 people come in with the 5 symptoms the same. They all have the same disease. All of a sudden I'm thinking, well, this person has one thing and this person has another thing, but if they have a sleep disorder, I can fix that. I can be a hero with no pills. That would be great. So I'm starting to look at it differently. And then I have this 72-year-old guy who comes in. He's got daily headache. Well, I happen to be practicing at a time when I have a CT of his head already. He has normal anatomy. That guy has a migraine gene. His sisters had migraine when they were young. His mom had migraine. He never did. Why is his headache coming on at 72 instead of 15? Look for his sleep. His sleep has become abnormal in the last 10 years. What that implies is he has to have the migraine gene in order to switch on that little head pain area. But we all have these genetic diseases. For instance, every epilepsy patient who has a genetic epilepsy, when you do testing for that gene in 3 generations, what you'll find is 8 people have the gene. 4 people have had seizures. 2 of them had a single seizure. 2 of them are on epilepsy medicine. They all have the gene. Why? Why is it different? This is what the doctors say. We see that. We see that. Okay, that's great. What can we do about it? Nothing. It turns out that when the sleep goes bad, we stop repairing our genetic weaknesses. What does that mean to me? 1, if you don't have the migraine gene, you'll never come to see me for headache. You'll come to see me for something else. My practice is such that I don't see people who got shot with a shotgun. What I have in my practice are people who are living their life, they eat well, we have the most wealthy, best informed population ever to exist on the planet. They're just living their life and all of a sudden their nervous system starts to go bad. Some of them have little twitches, some of them have seizures, some of them have burning in the feet, some have headaches. Something has happened to them while they're leading their normal life. That means most of the diseases I see are of a genetic basis. But they've had those genes since day 1. Why are they showing up now? Was one family member get diabetes at 82 and another one at 42? Look at the sleep. You fix the sleep. The brain has been repairing that genetic weakness since the day you were born. It finds a way to shore up that weakness. Once you see it that way, all of a sudden the idea that you could correct the sleep has amazing possibilities. Okay, so here's what we do next. What's going on here? why is this malfunctioning? How come nobody's teaching me what to do about this? Why don't I have any pills for it? And here's what happens. July of '09, I'm sitting there with one of my poor patients, 18 years old, daily headache sufferer. She went to her sleep study. She comes back. She's sitting with me. My sleep study evidence is she has 35 unexplained awakenings an hour. She never stops breathing. She doesn't kick her legs. And she's already asleep. She's very tired. She comes back, and I'm looking at this sleep study going, this is a disaster. She has terrible sleep, and I have nothing to do for her. A CPAP mask makes no sense. I have a bunch of sleep medicine. She's already asleep. What should I do for her? By accident, I say, well, because I don't really know what else to do, did your doctor do all those fatigue labs? She's really tired. I've already given her verapamil for a daily headache. It's a little bit better. I'm really tired. We do her B12. Her B12 is 175, really low. This is an 18-year-old. Why would she have a B12 that's low? Number one, I've never done a B12 on a headache patient in my life. I go to Google, B12 deficiency symptoms, fatigue, daily headache is second. Now at this point, I'm about to shoot myself because I consider myself a headache patient expert. I've never done a B12. It's not in the neurology literature. Now that's a little upsetting. You know, I read all these books, I read this neurology literature. It's supposed to tell me the truth. Right? No, she has terrible B12 deficiency. Now, for the first time, because I'm thinking about those pacemakers all the time, well, they've taught us in Parkinson's disease is the pacemakers that use dopamine, if you cross-section the brainstem and you look at all the little nuclei that use dopamine, the pacemaker cells fail first. The theory is that the pacemaker cells, because they keep beating the day that that's formed, they never rest, they never stop, they beat all day, all night, they have a higher metabolic demand. So the theory behind Parkinson's disease is it's a toxic exposure that those pacemaker cells are not able to repair. So for the moment I think, wow, B12 deficiency. What if her brainstem needs that stuff and the pacemaker cells fail first? Every single cell in the body is B12 deficient, but those pacemaker cells need it more. And you know what? Those 72-year-olds who come in to see me with daily headache, they all have pacemakers here. Maybe the pacemakers here and here are failing at the same time. So like a maniac, I start pulling blood on everybody who comes in, right? I'm doing B12s on everybody. By accident, 1 month later, one of my patients says to me, my doctor did my vitamin D level, it was low, she gave me vitamin D, my wrist pain went away. And I think, I don't care about that. I don't care about vitamins anyway, you know. And if she hadn't said my wrist pain went away, I wouldn't have even cared at all. But she happens to have a lot of things wrong with her. And I still have a whole body of patients who are on the CPAP mask and still have back pain, still have leg pain, still are having daily headache. So I, unfortunately, get left with the ones that don't succeed, all the things I'm trying. So I think, well, I'm drawing blood anyway. Throw the vitamin D in there. So for 4 months, between August and December, I draw bloods on everybody, and I do B12 and a vitamin D level. By November, now I'm really happy because I don't have to do the sleep. Chuck's sad, but I'm happy because I'm not sending off sleep studies every day. And then I don't have to call them up and tell them about their sleep studies every night. But instead, I'm spending an hour and a half filling out these lab slips every night. And every night I'm writing, your vitamin D is low, take 1,000 international units of vitamin D. And then some of them are B12s low, and some of them they're not. And by November, I think, you know, my husband is still nagging me. I don't get home until 9 o'clock. I'm going to Xerox this lab slip that says your vitamin D is low, take 1,000 international units of vitamin D, because I write it 15 times a night. And then I think, wow, this is weird. Why is everybody's vitamin D low? I mean, these are young, healthy people. I know 2 things about vitamin D. It comes from the sun, and it's about the bones. That's as much as I know, but I think, wow, this is weird. If we make it from the sun, it's August to December, shouldn't be the highest of all? This is strange. Everybody's below 30. I don't even know what the normal range should be except what's written on the lab slip. I think that's weird, but I never really think about it any more than that. So in December, 2 of my patients come in. They've been wearing CPAP for a whole year. The first guy says to me, I've been wearing this stupid mask for a whole year. I am asleep. I wear it all night. My wife will tell you that I got it on when I wake up in the morning, but my headache is still there. But the good part is, the last time I was in here, you sent me that little note about the vitamin D. I started taking the vitamin D. And in about 3 or 4 weeks, I noticed I was waking up more rested, and my headache went away. And I haven't had a headache for 6 weeks. And I go, wow. Now that is interesting, because the B12 was there about 1 in every 20. Really sick ones. The ones that are on the mask and are on 15 medicines, they're just miserable at age 35. They have B12 deficiency. But every single person with a bad sleep study has a low vitamin D.